Hello and welcome to Sky's the Limit, and I'm your host Sharmeen Ali. Today we bring to you a very special guest who is an achiever, Pakistani who went abroad and then came back, brought his expertise back to Pakistan. His name is Prof.Muzaffar Lateef Gill. He is the Chief of Digestive and Liver Diseases at Pakistan Air Force Hospital in Islamabad, and he's also a professor at Fazaya University, a professor of medicine, and many other achievements he's got under his belt. One of them being the recipient of the Sitara Imtiaz Award, which is the highest civilian award in Pakistan, given to him in 2006 by President Pervez Musharraf. We'll talk to him about his contributions to Pakistan and about his flourishing in his career, how this took place, because he comes from Multan. He's very proud to say that he grew up in a village in Multan, and then he had this journey towards where he is now. I'm sure that our viewers will find him very inspirational. Let's introduce you now to Professor Muzaffar Lateef Gill. Thank you so much, sir, for joining us, and welcome to our program.
Sharmeen, first of all, I'm so absolutely honored and humbled. I'm thankful to you and PTV World for this opportunity. I think you're very kind in your intro. It's my proud privilege to serve our nation, and especially Pakistan Air Force. And here, as we were discussing, this is a new facility, this Pakistan Air Force Hospital Unit 2. It's both for the entitled, we call it, the people who belong to Air Force, starting from entry-level worker to very senior Air Force officers, and it's for civilian population as well.
So, Professor, you're working here as the Chief of Digestive and Infectious Diseases at the Pakistan Air Force Hospital. This is a private setup as well. It's also for the officers and the people serving in the Pakistan Air Force. Tell us a bit about that.
This is predominantly for the civilian population.
Right.
And we cater to our entitled population as well. And this is basically affiliated with Pakistan Air Force College. We have built, it's called Fazaya Medical College.
Right.
And Fazaya Medical College, the teaching hospital is this Air Force hospital. So we work for our uniformed officer, and predominantly this place is for civilian patients. They can come and we provide all kind of services, and then it's a teaching hospital for Fazaya College to teach our medical students.
So, Professor, first we'd like to know a little bit more about you, because as a person in your position, as a role model for people in our country, what you've achieved, where you've come from is very important for our public to know. Then we'll also go into the issues in healthcare in Pakistan, which are very important as well.
I'm usually not very much into talking about myself, but just to give you a little background. I come from a farming family, and say little Tehsil, now Jahania, it's a village place, and my father is very proud agriculturalist, and basically I'm from public serving farming family. When I was growing up, and especially in my school days, the strong influence I have was one of my teacher. His name was Chaudhry Muhammad Ali. He's no more in this world, but I'm becoming emotional mentioning him. He is the one who actually cultivated and ingrained discipline, devotion, and dedication in me. He was my teacher and tutor from my age 10 to 16, those 6 formative years.
So a teacher can make all the difference in a person's life and their future.
I owe a great deal to Chaudhry Muhammad Ali. And then, you know, I saw my father. He was very advanced scientific agriculturalist, and he worked very hard in, you know, our orchards and different things. But I have yet to see a person who is more confident, self-assured, and comfortable in his skin. This is what he gave me.
Right.
Do all the best you can to all the people you can.
Doctor, I would like to just now touch upon what you said about your teacher. Of course, we know that parents have a huge role in a child's rearing and their confidence and where they end up in life. But teachers, I'd like them to hear this message, because you mentioned it specifically. What was it that this gentleman imparted to you that you feel formed you as a person?
You know, those years are formative years. And I was observing of his ethics, manners. Well, you know, this village and small areas, it's a feudal type of structure and living. This gentleman was self-made from humble background, but he was never influenced from wealth or status or, you know, when I was growing up as a school boy, I saw him, he was never influenced from anyone's wealth or status. And he was so self-assured, and he taught me one thing. He said, "Beta, if you work hard and keep your head down, and you know, universe belongs to you."
Yeah.
And he cultivated a discipline. You know, from those years, even on Eid days and other time, I used to study whatever discipline I was, like in a medical school or college, 4 to 5 hours daily. Okay. This is what I picked from him. And I know it's an English program, and he told me once a verse from Allama Iqbal. And that just went into my heart, and I never looked back. And that is, "Ghairat badi cheez hai jahan-e tagodaw mein. गैरत बड़ी चीज़ है जहाने तगोदौ में दरवेश को पहनाती है ताजे सरेदारा."
And the meaning of this for?
Its mean is कि it's not the material wealth which is important. It is your ethics, character, discipline, and your pride.
Okay.
And this was the reason when I got my training in the US, I was done, finished, I worked couple of years, and I decided that I will go back to our country, and whatever my capacity and abilities are, I will serve the nation with utmost dedication and devotion.
So Doctor, we were talking about now you went to study in the United States of America, and we all know the appeal of life in the United States. It's very easy to live there. You don't have the kind of obstacles one faces sometimes in Pakistan, being a developing country naturally, which are there in all developing countries. So you went from Nishtar Medical College, then you went to the United States, got trained there and came back. Tell us a little bit about that. What was the lure of coming back to Pakistan when you were clearly doing very successfully in the United States?
You know, I think it's very important to know. I was the youngest division chief in US history. After my training, I was working for one of the Army hospital, Veterans Affairs they call it. But to tell you, as I said, I come from a village farming family, and I have observed people suffering because of poverty, because lack of education, lack of health. And it was basically my grandma's desire, and she was another role model for me. She was very pious, religious lady, and she used to tell me that I should become a good doctor. And she used to use a phrase in Punjabi language, कि come back, changa doctor ban ke wapas aayi. And she's no more in this universe. Unfortunately, she died when I was even in medical school. So I think American life, America corrupts you. Once you live there, it's very difficult to come back and do. But I had bigger ideals, as I told you. When I was there, and when I came here 2003, there were 26,000 American gastroenterologists in the US. In our country, we have appropriately trained very few gastroenterologists.
Okay.
And it has always been my desire, you know, to be in our own country.
Let me ask you one thing. I'm sorry for interrupting you here, but what you've learned in America, the United States, obviously it's a different environment in the medical field as well. Different illnesses you face as well, all of that, patients are different, everything. So you come to Pakistan and you have a completely different set of patients, the work environment that you're in, everything. So you're applying your speciality from there and your expertise from there to a new place. Naturally, it's great for Pakistan to have that knowledge and experience, but what was your experience like doing that?
Listen, when you migrate from one country or culture to other, going to United States and then getting adjusted and learning, you know, their way of living, it's a challenge. And then you have to unlearn when you come back.
Yes.
Our society, unfortunately, as we speak, we have lack of tolerance. We don't believe in coexistence. It's a very corrosive and vitriol attitude we have. And in medical profession, you know, when I was growing up, the teachers at that time, I am graduate of Nishtar Medical College, Multan, and what I noticed was, it's very sorry to say, people pose question, the doctors, my senior, to the medical student just to insult them, that they don't know, they are insufficient, they are inadequate. What I learned in United States, they tell you, they don't ask you, they train you. You know, all those exams I have done, you don't have to sit and cram the books. They slowly and gradually take you into phases and train you one of the best. Americans' training and, you know, practice environment is second to none in the world. But when I came here, this is what I try to, even today, my junior colleagues, they are just my buddies, they are friends. From students, you know, I'm very honored and humbled. I never ask them, okay, what is this and what is this? I just tell them, okay, beta, this is what it is. And I think this is my request message. If you are in life with like 15 or 20 or 25 years ahead of others, it does not give you a license to humiliate or insult
and belittle
others.
others.
No.
Yeah, and you have to allow them room to grow.
Yeah,
right.
Because there is nothing grows, you know, fast if you cultivate confidence, friendship, collegiality with them. And I think there is a lot of insecurity in our culture, be it a medical profession or any other. And Sharmeen, I'm very honored and humbled to share with you. I am here for the last 15 years, and I was able to send at least 30 young doctors to United States. And the first gentleman who came and worked with me is himself an associate professor in gastroenterology.
Wow. And when they start out, they're not very confident. They don't think they'll get so far.
Even now in Pakistan Air Force Hospital, no matter how busy I am, I make it a point that I sit with final year students, take their classes, be with them when I'm doing procedure. They giggle, laugh, crack jokes with me. And you know, I take them as my children. They are future of the nation and of the world. So I think we need to understand there is nothing parallel, nothing equal, nothing close to being respectful and teach respect to people.
Right.
No matter what your social status and situation is.
Right, and that is something you picked up from your father as well as your teacher, and then from the United States when you worked there. So you brought this all back, the way of working with others, which is key, which you brought back into your teaching.
I think, as you rightly said, when I was growing up, I learned from my teacher. I will name him again, Chaudhry Muhammad Ali. He was only sensitive to people's character, students' achievements, and even underachiever, but he was very friendly with everybody. Then my dad, I saw him treating with our workers in the field, with his friends, be it poor or rich. I think my dad still, Allah bless him in health, he's mashallah 85-year-old, and his best friends are his staff member, I don't want to use word servants. Yes. We always, when I was growing up, we used to address them as Chacha ji, yes, or you know, that type. And this is still his biggest asset. This is what I learned from him.
Let's just go a bit into detail about that, because you were also, you're teaching in the United States at a medical school, and then you're working with the US military. Tell us a bit about that experience.
You know, first of all, I was amazed. Americans, most part, the people, they are very nice, kind and friendly. When I was a trainee doctor, you know, there is a collection in the morning, people sit and there is a meeting, it's called morning report. Chief of medicine sits. They never ask you questions. In our culture, I will ask a junior doctor a question, I know he doesn't know the answer. It means they try to dominate or belittle. This was not the culture there. And it may be a very small thing for you, Sharmeen. One day, I was very new in the US. Everybody was sitting and chief of medicine came. And I was the product of a small city called Multan, where I went to medical school. So we have very different notions and ethos. The guy came, he stood by the wall and grabbed his own coffee. I didn't know he's chief of medicine because I was fairly new. And then later on, he himself approached me and a couple of other young doctors. He said, hey, I'm very privileged to name him. His name was William Keane. He said, hey kiddo, I'm Bill Keane, chief of medicine and player, welcome on board. So this is the difference.
No pomp and show, it is very down to earth basically. That's Americans for you.
No,
yes.
This is, I think there are some very good values which I brought and today I do with my students, with my colleagues. And you know, in Islam it is said, okay, you know, you should be the first to greet Assalamu alaikum, salamti, it means blessing. And we are very miser in this. If I am senior and somebody is few years below me, I said he should be the one. So this is what I learned from Americans. Actually, it's the teaching of Prophet Muhammad sallallahu alaihi wasallam, which we don't do. Working environment, no one ever asked me who I am. I'm, you know.
Whose son are you, or what is your family legacy, which is the thing in Pakistan.
This is what I admire the most. And when I came back here, so here what we do, I hardly ever talk personal with my colleague and students. We just crack jokes. They are at ease in my company. When I teach final years or fourth year students, or you know, they can come easily and they make every sort of comment, you know, as you make to a friend. So I think this is what we need to work on it. The young people lacks confidence in our culture.
So then working with the US military, what was that experience like?
Actually, I was not directly involved in military operations and it was a military hospital.
Right.
It belongs to, it's called Veterans Affairs. It's basically caters to the retired army people.
Okay.
And some stations serving too. And I think American veterans, they were full of pride and they have served the nation, whatever. And I discussed with them, you know what was the reason why you were, for example, in Vietnam and why you were in Iraq. And most of them said, Doc, it was call. It was a duty. And that's it. And I think we at this juncture in 21st century as a nation, I think we need to be a little bit kind to each other, respectful.
Absolutely. So, Dr. Saab, I'd like to now ask you this. So, you returned to Pakistan based on wanting to serve. Your grandmother had told you to study and then come back. So, you were true to that word that you gave her and you came back to Pakistan. This was in 2003.
Yes.
And you returned to Pakistan, and very soon afterwards, 3-4 years later, due to your service, you were the recipient of a Sitara-e-Imtiaz, which is the second highest civilian award, so for your services in healthcare. So please tell us a bit about those years, what you were doing that led to your receiving this award.
When I came here, you know, like these days it's a fear and pandemic of COVID. Everybody is worried about, and rightly so. And in 2003 and 2004, hepatitis C was a menace. It was public health issue. And treatment, diagnosis and type of treatments, it was in infancy then. Even in Europe and United States, we were discovering new modalities, new injections. But here in Pakistan, we did not have any appropriate policy. I'm very honored and humbled to share with you. I had the privilege of knowing General Musharraf, who was the army chief and president of the country. I knew Prime Minister Shaukat Aziz.
And you were also very close to Mohtarma Benazir Bhutto as well?
Yes, indeed. I will touch on Mohtarma in few minutes. So there was a lack of knowledge and expertise and implementation. So I had a chance to work with government in 2004. We came up with, first of all, public awareness. I did many television programs, went to small district hospitals about the disease, its propagation, and then how to diagnose and how to timely treat.
Because, Dr. Saab, this disease, a particular disease, hepatitis C, is deadly. It's very dangerous. It's different from hepatitis A, and there's a very little understanding about it, at least at that time. So can you tell us a bit about it and then your work?
Actually, as you, Sharmeen, said, there is hepatitis A and E. It's food-borne illnesses. You know, when your food hygiene is not good, they are self-limited. It's for couple of weeks problem and you are done and you are in good health. Hepatitis E can be difficult and dangerous if you are a pregnant woman or elderly individual. And B and C, we call them blood-borne diseases. You know, if you are using unsterilized equipment as a doctor, you know, barber shops, ladies goes to these salons.
Blood transfusions and tests, yeah.
You know. So C, hepatitis, and B, they are called blood-borne in general. In C, 70 to 80% people go on to develop what we call chronic hepatitis, and then liver suffers, initially inflamed and then shrunken. It's called cirrhosis. And that's a very dreadful outcome. And this is my message. You know, I have my colleagues in the US and they're doing very well. But I feel very honored and humbled and thankful to Almighty. It's very provocative phrase I'm using. You know, whole world is facing racism and discrimination.
Yes.
A friend of mine visited me and he said, "Hey buddy, how is life?" This is American. I said, "Jim, I think it's very appropriate and privileged to live as a first-class citizen in your own country,
yes,
than
absolutely.
a third-class citizen in first-world country." And he became red and started looking. He said, "Doc, you made a point." So my message is, I love Pakistan, and to be precisely Islamabad. And I will not exchange anything for my devotion, dedication, for my soil, and there is nothing more important than to serve. You know, I have all strata of patients. Poor farmers, it gives me more pleasure to welcome a gentleman from Mandi Bahauddin, from Jhelum, from proportion of Kashmir, from very remote corners of Pakhtun districts. And when I hear from them, women will say, "Doc is our brother." A village man from Mandi Bahauddin or Jahania or Multan, they will, for certain reason, address me, not a doctor, and they will say, "Chaudhry Saab, pleasure meeting you. It's an English program. I just don't want to use those colloquial words." So this is what
People's prayers, you must have so much, so many
Absolutely.
of those, because you're...
And in this stage of the profession, I've had this opportunity to serve an institution which is second to none in the world, Pakistan Air Force.
Right, so let's come to that now. Basically, you got the Sitara Imtiaz. How did you find yourself then working for the Pakistan Air Force? Again, you went from US Military Veterans Hospital now to Pakistan Air Force. What is it that draws you to the military
I think
environment?
it's my humble claim, that I am a soldier without uniform. वर्दी के बगैर फौजी आदमी हूँ मैं. तो I have very keen fondness for military history. and military leaders, and how we are 1/5 of the size of India. And I was reading very neutral Air Force history. And not that I work for Pakistan Air Force. It's a brilliant organization, how they have defended the nation.
Yes, absolutely.
And their professionalism, their devotion and dedication.
So these are our heroes. I mean,
these
they
are
give so many
heroes,
sacrifices
and
for us.
then when they opened medical college and this, you know, and I want to mention another gentleman. His name is Major General Safdar Abbas, who is our current executive director. Safdar and we went to the same school. He is actually 3-4 years senior to me. He is the one who, you know, I would say he's my brother, instructed me, hey, come and join us and help. So then I never looked back. And it's my joy to train future generation of doctors in which belong to not only nation of Pakistan, but then they are graduate of Pakistan Air Force Hospital and Fizaya Medical College. So this is actually at this stage to give back to the nation.
Right.
And my wife says you are not made for, she's very proud Pakhtun lady. And when I started here, she said, and I understand little Pashto, but she's a doctor herself. She said, Majan, how would you cope with this rigorous discipline? You have a feudal mind and all. I said, no, I will prove you wrong. I can be very disciplined. And I think I don't like to work for these private organizations who are owned by certain groups or individuals. This is a national institution. It belongs to the nation of Pakistan. So when I come here, I have served, you know, one of the best university in the United States, University of Minnesota. But when I enter in this hospital, when I enter in Fizaya Medical College, I have mixed emotion. A farmer's son from a small village, making to Air Force, serving the students and the patients without any discrimination. I think I could not ask God Almighty Allah more.
Right, it's your abilities that they value over here.
Well, it's very kind of them. It's not only ability, it's, you know, big blessing of God Almighty. And I'm filled with pride and honor and dignity that I'm part of the second to none institution in the world, Pakistan Air Force.
So at the moment you're wearing several hats. You're a professor of medicine at Fizaya University, and you're also chief of digestive and liver diseases here at the Pakistan Air Force Hospital, where we are right now.
Yes.
So tell us a little bit about these two roles. First of all, you've brought in some new technology here in liver and digestive diseases. Let's talk about that first.
You know, we have this, where we are sitting, Unit 2, we have the best state-of-the-art equipment. We do all kind of general to very advanced therapeutic procedures. And I have very strong support of administration. And we cater our entitled patients and civilian, you know, general public. And college side, we are involved in teaching. And we have a team. I'm very proud of my assistant professors, Dr. Arsalan and young Dr. Anam, and our professional technical staff. And as you have seen, the leadership of the hospital is in a big support.
Right. As a professor of medicine, you're doing this as well as a voluntary job.
Yes.
And this is again another service to the country, because as a professor, you're volunteering your time to teach these medical students, and this is not something that you do for any personal benefit at all.
I won't call it voluntary, it's a duty to the nation. Since it's a Pakistan Air Force institution, and it's just my very meager little contribution, and it's coming from very core of my heart.
With no salary,
No,
I'm just going to
no.
add here.
No,
right?
no. Actually, salary is not an issue for Pakistan Air Force, and they give me a lot of respect, acknowledgement, and love. I personally requested them that I will do what I can, whatever my capacity and abilities are. They are for Pakistan Air Force medical discipline, but I won't claim any compensation, no financial, you know, whatever as a professor's salary or stipend or remuneration, whatever word you want to know.
Right, and how fortunate these young medical students are to have a top doctor teaching them, you know, and being a mentor for them.
I think it goes both ways. It gives me immense satisfaction that, you know, I'm able to pay back to the nation. I think Pakistan has done a lot for me. Average American graduate from a medical school is under the debts of close to $100,000 US. In my time, I went to our government-run medical school in Multan, and then, you know, it's a little embarrassing, but let me share. I am the youngest recipient of Stara Imtiaz in this country.
Okay.
So what else you want? I was just 42-year-old. Okay, and this is what Pakistan has given to me.
Right.
So it's my time, and I will request everybody that just contribute whatever status situation you are in to the nation building.
Yes, we absolutely have to acknowledge how much Pakistan gives us, because the mindset right now that you have amongst young people is to just leave, you know, leave Pakistan and go elsewhere and have a better life. But we fail to acknowledge how much Pakistan gives us. Like you're saying, government institution educated you and there were no student debts, etc. I'm an anchor here on a state channel. That is an opportunity Pakistan has given me. We have to acknowledge these things and not just jump ship and run away.
No, listen, you know, 14 years is a long time. I spent 14. The peace of mind, satisfaction, confidence, exuberance I did not have in the US. I was another financial immigrant. Okay? Here I'm very humbled, honored. I am able to serve common man, very senior civil military bureaucrats. This is my soil. I am son of the soil. I think it's no harm going abroad, get trained,
and learn.
Get and learn.
Absolutely.
And then, you know, come back if you can and be proud Pakistani.
And Doctor, I mean, we're both former expats. I was also in the US like yourself. The sense of community that you get over here, and just the feeling of belonging, which is something in the United States, it's a wonderful place to live. It's got everything, and you know, the system, like you said, it's inclusive and it does a lot for you. But the community that you get when you come back home to Pakistan, that's a sense that you don't get anywhere else.
You see, it's provocative, but they say America is a melting pot. It's not a melting pot. And recently, in whole world, like Europe, US, there is extremist movements, and you know, I was the division chief in one of the Veterans Affairs hospital, but I was not part of many decision making. I was not part of social life. People are embarrassed to share this. You know, there are segregated.
There's a glass ceiling for immigrants. That's what you're trying
there
to
is. I mean, not only for immigrants. It's America is a color and race-based society.
So, Doctor, now let me ask you this. You know, when you have people returning from overseas, you tend to bring back new knowledge, new technologies to your field over here. So, in your particular field of gastroenterology, digestive and liver diseases medicine, what type of technologies have you tried to introduce here? What new sort of innovations can we expect to see in this field?
Listen, when I came, there was few procedures which were not known in our medical setup. One of them was endoscopic retrograde Gallangio pancreatogram. It's a medical jargon, I will summarize it.
Yes, please.
It's called ERCP, okay? This is a procedure when you have a stone in the gallbladder and it slips to the tube. In 80s and 90s, what they were doing, there was open, you cut your belly and remove it. So when I came, this procedure was not very much known, common, and I have a privilege of setting up not only the equipment and technology, but teaching many this procedure. And this saves hospitalization, cutting your belly, and time, energy sources.
So it's kind of, it's an endoscopic procedure.
It's endoscopic advanced therapeutic procedure. And
is the patient under anesthesia or not?
No, you give little, we call it conscious sedation. Patient gets some medicine, but they breathe their own. We have now, for the last few years, we involve anesthesiologists, the doctor who sedate the patients. And patient, after it's 20 minutes procedure, they stay with us like another, maybe an hour or so and go home, 90% of the time. This is one thing. The other thing I want to talk about is the concept of practice. I again refer you to this small town Pakistan, our village. You know, there was a fear among patients from a doctor, what I used to see when I used to go to a doc with my grandma. We try to remove those barriers, be friend with patients, be kind to them. It's a I mean, all professions are public service, but medical profession requires humility. If you need power and prestige and arrogance, this is not the profession.
It's really all about your bedside manner at the end of the day, how comfortable your patient is.
How you win the confidence and how you empathize. You know, sympathy and then empathy with the patient and their situation. And I think this is the most important for our generation.
Absolutely.
New, young.
So
how you feel their problems.
Right. Doctor, now that we're coming towards the end of our discussion with you, and then we'll go and see you at work as well, two very important things I want to ask you about. One is the majority of the public health issues that we face in Pakistan. Right now we're fighting COVID. With all your depth of your knowledge and experience, how do you feel that we know what's lacking, we know resources are lacking because the country is a developing country, naturally that's going to be happening. So how do you feel that we can right away sort of improve the situation that we're in? Well, immediately what's needed?
I think this, if you're referring to this COVID epidemic, one thing is mask and social distance.
Okay.
You know, we should try to avoid gathering with these weddings, closed hall things.
So personal responsibility we must take.
If we become, you know, frequent hand washing, mask and social distancing, I think we have close to 70% control. But in our public demeanors, we are not observing this. And there is, this is hope if you have mask and social distancing.
Doctor, also the paying attention to hygiene, even like the infectious diseases that you were talking about earlier, hepatitis C, etc. The knowledge and awareness about hygiene in our country, how important is that? That can prevent so many illnesses.
Going back to hepatitis C era, we have done very aggressive campaigns, and there is now actually new cases of hepatitis B and C are very low. But we have pool of patients who have suffered and now their liver is compromised. In terms of COVID, you don't need much resources, you know, just social distancing and mask. But our public transport, it's a poor country, we, you know, cannot afford this. Schools, even in Islamabad, these private schools, you know, how much one can observe. The only cure will be, you know, other than these two, the ones we have a vaccine for COVID. But meanwhile, I think we all should strive social distance and mask.
Absolutely. And finally, I'd like for you to give a message for our youth, because they're seeing you as a role model, maybe future medical students, or even as an achiever. You yourself say you come from a humble background from a village in Multan, and you've achieved, mashallah, so much success in your life. What would you like to say to the youth and about the youth and how to groom them in Pakistan so they can also achieve and succeed and contribute to Pakistan?
I think the simple message is, be honest to yourself, do whatever you can. It's easy to be a it's okay to fail, it's okay to be mediocre.
This is very important. The room to fail and get up and try again.
Get up and walk. And consistency, work hard. Life is a long journey. It has many ups, downs, obstacles, okay? And just be comfortable in your skin. Pakistan as a country has tremendous potential and resources. And I hope our young generation have better Pakistan. And my message to them is, love your country.
Okay.
Love Pakistan and do whatever you can. But it's not, you know, your victories which contribute. Failures are part of life too.
Yes.
And we should be equally sensitive and possessive of our difficulties and failures.
Because we learn and grow from them. Very
One last thing, as a medical student, Sharmeen, I was insulted many times in ward rounds as a medical student by my senior teachers. Not only me, many others. But that has given me a fire in my belly, a passion, A, to succeed, and B, the junior and younger generation to treat them better. We should not be revengeful. We should not be sarcastic.
Or bitter or negative.
And carrying on vitriol. Just love people, whatever they are, whosoever it is. And it rewards you big time, personally, professionally.
Yes.
And it's a big claim. I was the first recipient of the civilian award from my medical school. There was a generation before me, well then after, when one of my professor of neurosurgery, he died in a plane crash in Multan. This is the year when I was given the civilian award. I requested Excellency Prof.Muzaffar that, sir, if it's okay, just give this same award to my dead professor. And I'm very thankful to Muzaffar. He not only considered it, but it was given to a professor. I think
acknowledge others.
Acknowledge others, distribute your success, your opportunities with everybody.
What a wonderful and inspirational message, Professor Muzaffar Lateef Gill. We're now going to go with you and have a look at your practice and how you are in action. So this is very exciting for our viewers and us. Let's have a look. At this point, we have with us the Executive Director of the Pakistan Air Force Hospital in Islamabad. We're very fortunate to have with us Major General Safdar Abbas, who is a very renowned personality in this field of medicine and in hospital administration. Thank you so much, General Saab, for joining us. We're here in your hospital, and it's a very elaborate setup. Can you please tell us a little bit about this Air Force Hospital and the number of patients you have here, how long you've been in operation, and the kind of staff, the level of care that you're giving your patients over here?
Well, you see, Madam, this is a tertiary care hospital. We are providing almost all areas of care to our patients, including medicine, surgery, obstetrics, gynae, pediatrics, as well as for cardiology, gastroenterology, and nephrology, neurology, urology, all. this is our second transplant, renal transplant today.
Okay.
We are going for that.
Oh, really? Okay.
Yes. And for the last about 2.5 years, you can say more appropriately, this is working and making a lot of contribution to the patient care. In the last, few months' time, when COVID was very rampant all over the world. So this was the only hospital which was working as well in the OPD for COVID as well as non-COVID patients.
Right, because a lot of people had,
yes,
a lot of hospitals
we segregated
had
both
closed.
the class of patients and made lot of care for such patients. See, and because every patient comes to the hospital for the hope, he has some hope to do that. So he should not be refused in any case.
Absolutely. And General Saab, also in this hospital, you've got a very highly specialized team of individuals and technology as well. Could you tell us a little bit?
We are lucky enough to have very high-class trained nurses from very renowned institutions of the country, as well as the specialists, the consultants who are working with us. I mean, very renowned names. And they have got a lot of international collaboration, lot of international contributions, and performing wonderful job in their own specialties. Like I'll be talking about gastroenterology. We are doing almost all types of procedures, including the complex cases, and a lot of referral is there to us for such cases.
Okay.
And it's a very, very safe and very ethical way of doing things in the hospital. Absolutely. At the same time, the training of students, training of nurses, paramedical staff is going hand in hand. So everybody is contributing a lot.
Right, right. Yes. And this is also a hospital that caters to civilians, not just serving Air Force personnel. You've been the head of, you've been in AFIC, which is a very renowned hospital. Would you say that the standard here for the civilians is at par with, because we know that the army hospitals give excellent service, so would you say that the standard here is the same?
It's very important. The patient is a patient. You have to treat him accordingly, as per the need desires, and to us the patient status is not really mattering much.
Right.
In any case, because he is a citizen of Pakistan or he is some foreigner. So in any case, for a doctor and for the hospital setup, it should be totally indiscriminate.
Right. So the standard is the same as the other army.
The level
Air
of
Force
care
facility.
is the same.
That's wonderful to know. Thank you so much, General Saab, for joining us on our program.
Very
and
kind.
It's a pleasure.
Thank you.
We've also got with us, who's joining us, Air Commodore Nasir Abbasi, who is the officer commanding for the Pakistan Air Force Hospital here in Islamabad. And he's, of course, a doctor as well. Thank you so much, Air Commodore Nasir Saab. Can you tell us a little bit about this hospital, being the officer commanding? The staff that you have here, you have renowned individuals like Dr. Prof.Muzaffar, Lateef Gill, etc. Can you tell us a bit about the strength of the nurses and doctors? How many are civilians? How many are Air Force personnel? How does it work exactly? And how many beds do you have?
Well, this is a unique model of the hospital in the forces, which is never existing before. This is a hybrid model working with around 80% strength of the civilian specialists and nurses and other supporting staff, and around 20 to 25% of the persons.
And your staff here, they come from your own Fazaya University
from
as
the
well.
Fazaya
And it's
University,
a teaching hospital.
And this is a teaching hospital. And we have the students of Fazaya Medical College, undergraduate students with us. And these students are lucky to have to witness this kind of procedures in their early days of learning, because they will remember it forever. And we're lucky to have this setup headed by Professor Gill, and he is rendering valuable services not only in the teaching but also in the management of the patients and in the care of the needy people.
Thank you so much, Air Commodore Nasir.
Thank you very much.
So now we'll be meeting some of the key doctors over here as well. We have with us Dr. Anam Abbas. Now she's a lady gastroenterologist. Thank you so much for joining us on our program. Just tell us a little bit about being a female as you know, gastroenterologist in Pakistan. It's kind of like a rare discipline over here. Tell us about your experience in working here at the PIF hospital.
There are less female gastroenterologists in Pakistan, but the setup over here is very good. It's state-of-art setup, and working with Dr. Gill is wonderful because there is every type of procedures available. We can perform upper GI endoscopies, lower GI endoscopies, as well as ERCPs. So we are catering patients from all over the Pakistan and providing them services regarding any of the gastroenterological complaint they have or hepatological problem they have.
Okay.
We even evaluate patient for any liver disease and consider for the transplant, and we inform the patient if they need that.
Okay, thank you so much, doctor.
Thank you.
So now we're going to talk to another doctor who sort of is in charge of this gastroenterology area, works very closely with Professor Muzaffar Lateef Gill, Dr. Salan Shehzad. Thank you so much, Dr. Saab, for joining us. Dr. Muzaffar was saying that you run the show over here in gastroenterology. You're also an assistant professor. So what is the environment like over here for young doctors like yourself, the opportunities that you get, and also as a professor? Tell us a bit about that.
First of all, thank you very much, and thanks to Dr. Gill as well for his leadership. We feel very comfortable here. The thing which we introduced here under his leadership, we do painless procedures.
Okay.
We have, alhamdulillah, almost 0% complication rate in the last 1.5 years of about 800 procedures which we did over here. So we ensured that whatever the procedure we do under anesthesia, with anesthesia team. Patient come and go without any pain. We monitor the patient, it's their parameters, all things, and we grade the patient according to complication assess. We assess the patient, and we have a proper protocol to manage each and every patient. And alhamdulillah, in the last 1.5 years, our success rate is near to 100%, and complication rate is 0%, because we are following strict protocols, SOPs, according to international guidelines.
Brilliant. Thank you so much, Dr. Salam.
Thank you.
Dr. Saab, thank you so much for joining us today and giving so much of your precious time.
Grateful and indebted indeed.
So we've spent this last 1 hour with a very interesting personality who's inspired us all to do our best and give back to our country as much as we can, and that we have to uplift each other and work together as a team and help each other overcome obstacles. And there's no such thing as failure. We have to remember that from what Professor Gill told us today. So that brings us to the end of our program today. Hopefully we'll see you next time again on Sunday, same time on PTV World on Sky's the Limit.